1, 2, 3, 4, let's go.
It's a fabulous show.
Alaska. I heartbeat Alaska.
It's heartbeat. Alaska.
Pull up a chair and enjoy the show.
Hear it from Sitka to Barrow. Gather around for Jeannie's show. It's the Aleutian, the Indian, and the Eskimo. It's the Aleutian, the Indian, and the Eskimo.
Welcome one, welcome all.
Today we travel to remote villages once again throughout Alaska. This time we take a look at another problem, a problem called tobacco. A few weeks ago we covered chew or spit tobacco, and this time we take a look at the efforts to quit the use of tobacco throughout the state. It's a great show. Let's take a look again at tobacco use and the efforts our people are making to stop nicotine use in rural Alaska. All across Alaska, times are changing. Tobacco, once a mainstay in rural Alaska, is beginning to fade away, but there's still a long way to go. Tom Tilden came to Dillingham in the late 1960s.
I remember the first time I came to the hospital here, the people used to smoke in there all the time. They used to smoke in the rooms, and they had ashtrays in the rooms. They used to smoke in the lobby area, smoke in the offices. All the offices had ashtrays, and now it seems kind of foreign not to have all of that here anymore. But at one time it was acceptable to do that. I remember I used to go down and visit people that used to smoke down there and ask them if they quit, if they want to quit, and they all thought about it, and I tried to get groups to quit, but that didn't go over too well. They didn't have, there was no program here for smoking cessation at the time. It was just people that wanted to quit that were willing and able to. And but now we have this program here, and it's available, and people could use it by, all they have to do is buy their by either buying the Zyban or the patches or the lozenges to help them quit. And makes it a lot easier for them to quit if they want to. Seen a lot of changes here. They've all been good, I think. That especially quitting smoking. I mean, that's I think that's harmed a lot of people, and it's now it costs a lot of money to smoke cigarettes, so people save a lot of money if they do quit, and save a lot of money in health care too if they quit, because they I know I called the legislators in Juneau and told them that they should fund smoking cessation programs, because if they don't fund them, they're going to fund them one way or another by paying for medical expenses of some of the patients that come and see us. So I think it's a good trade-off. Spend a few dollars in prevention and avoid paying a lot of costs later on down the road for health care. And seemed like a good trade-off to me. I know my daughter had tried a couple times in high school, and then she quit, and made me proud that she didn't get into the habit. And I hope that all all of the kids follow her example. So maybe we could go back in here. So this is a good program.
Tom is right. That is a good program. He's also right about how cost-effective it is. According to the Alaska Tobacco Control Alliance, Alaska's annual medical costs for tobacco use are $132 million. The estimated lost productivity from tobacco use, $129 million. It's clear that reducing tobacco use across the state could save us all a huge amount of money. Yet the state of Alaska will spend only about $5.6 million on tobacco prevention and control this year. CDC's recommended amount for a comprehensive program in Alaska is $8.1 million to $16.5 million.
I've wasted 20 years of my life puffing on a cigarette, thinking it was, I didn't think it was anything. It was just something to do. It turned into a habit. I was addicted. I don't have that anymore. That's a really good feeling.
Karen Lopez Johnson was a longtime smoker. She knows firsthand the value of quitting.
Oh, man. Try biking up Windmill Hill. It was hard. I couldn't do it, but since I quit smoking, I could bike up that hill. I could breathe more freely, and you're not spitting up all that yuck stuff that you normally do if you're a heavy smoker or even just a smoker. I also noticed too that, like, if you're talking or you're going on with a conversation, I could laugh without having a cough or having to go, clear my voice like I did when I used to smoke. Well, it's kind of a weird thing. It was a few years after high school, my first marriage and stuff. I had a job out at the bar, and everybody else smoked, and so next thing you know, I was smoking. I had been a basketball player all my high school years, actually since elementary school, and once I started smoking, that all just kind of stopped. I first quit 9/11, September 11th of 2003. That was actually when I first quit, and then I went over 8 months, and then I kind of went back to almost smoking again, but luckily I had her, and then she got me back into the program again. And then she left, and then Murtis came in, and so Murtis took over and was there as a excellent counselor for me. I mean, I would call her up and I'd say, "Gosh, Murtis, you know what? I'm just having a craving here. I don't know what I'm going to do." And she's, we got back on the Zyban. The Zyban was actually what was a big help to me. I stayed on it a couple months more because I didn't trust myself, and I did not want to start again. I thought that was one of my best accomplishments since I became a mother. I mean, you walk up to somebody, you smell cigarettes, man, and I mean, it's nasty, and I think, oh man, that's what I used to smell like. It's yuck.
Karen would like to see others quit, sure, but she wants more.
Gosh, I wish they could ban cigarettes, I wish they could make it illegal. I've heard talk about that.
Chenega Bay is one village that might just make Karen's dream come true.
It's going to be provision that it'll be law in the village. Eventually we want to put it out at the airport where he says anybody arriving here is not allowed to smoke. That's a little extreme, isn't it? But I'm sure there's communities that are no smoking communities. Is there?
Country, Bhutan.
Yeah, see, there's countries that don't smoke. So we could be a village that don't smoke, right?
Right on.
That'd be a good goal.
To many, it may sound like a radical idea, but this is a village that knows how to overcome tragedy. In the 1964 earthquake, Chenega Bay was completely wiped out by the tsunami. The village was rebuilt in a new location on higher ground. The village recently completed this beautiful Russian Orthodox church.
There's 4 bells in there that were made in Russia, and after the after the bells were taken out, the catch was broken, so there's not ever going to be any duplication of those bells.
After the devastation of the '64 earthquake, the Bible from the church was recovered. It now sits in a special spot in the new church, safe from tsunamis. The village now is facing up to a hidden killer, tobacco. Tobacco use kills about 500 people every year in Alaska. Secondhand smoke kills an additional 120 people. This makes tobacco far and away the leading cause of preventable death. So what is Chenega Bay doing?
There's no black. No black.
The same thing every village should be doing, having lunch. But this lunch is more than just another song and dance.
Smokers love to smoke.
Andrew McLaughlin, one of Chenega Bay's hard-working health aides, is taking the opportunity to explain to anyone that will listen the real dangers of tobacco.
Maybe someday all these kids that we see here will have a non-smoking village, and then perhaps the people won't be dying of smoke-related illnesses. It seems like the biggest challenge for most of our smokers that have tried to quit is maintaining their abstinence. And what we need to do is recognize the triggers that make people want to smoke again. And a lot of the situations that I find out about when people start it up again are stressful situations, so.
But it's not just fire and brimstone, smoke and tobacco leaves. The village has a genuine commitment to helping people quit. Richard Komkoff lives here and smoked for many years. So has he seen the results of the programs in the village?
They've been going to the school and talking about it, and my children have been telling me about it too, so it's, I just want to...
So your children are bringing that message home?
Yes, they're bringing that to me and bringing it around, and so that's what's helping too.
And Chenega isn't the only place where the kids are taking charge of the fight against tobacco. Kotzebue, Alaska, far to the northwest of Chenega Bay. Here, the Maniilaq Association is using a radical new tool to combat tobacco. Well, at least it's new to the Arctic.
2 years ago, we decided we were going to try to address some of the rural smoking issues in the villages, and we started a smoke-free adult softball league in Norvik, Alaska, which was basically going to be most of our Kobuk River villages, which includes Selawik, Norvik, Kayana, Ambler, Shungnak, and Kobuk. And we started a smoke-free softball tournament, which we call the Summer Solstice. We've run it 2 years in a row. It's been very successful. It's very competitive. The villages had not had softball programs, so it was something that they had to learn how to play the game. We had to build softball fields, and we've been real successful, and the folks basically have to play by the smoke-free rules, where anytime they're playing the game or they're practicing or using the facilities, we ask them not to use any tobacco products. It's basically a message that we try to get out that to be successful athletically, you need to be smoke-free. And the people in the villages love it, and we've had a lot of good success. Last year, we were asked to expand it to include youth, because the youth have absolutely nothing in the way of organized activities in any of our villages throughout the region. So last summer, we started the Kobuk River Youth Softball League, and it's a smoke-free league. We had 245 kids learn softball last year for the first time, and we supplied all the equipment. Went to Norvik and got heavy equipment and built a field down near the beach. Sponsored 12 teams last year with uniforms and equipment, and sponsored 2 softball tournaments throughout the summer, as well as a number of inter-village play, which is just games. It was a real successful program. We had a large tournament with 12 teams in it in Norvik at the end of July, and we had great success. Kids were really positive about it, and it was so successful that we've had 3 other villages ask to be included this year. So we'll expand And this year we'll have Point Hope, Alaska, Noatak, Buckland, Selawik, Noorvik, Kayana, Ambler, Shungnak, and Kobak will all be part of our smoke-free league. And this is a real big program, but we hopefully are taking the message to the kids that to be successful, especially athletically, you need to be tobacco-free. We think the direction we have taken, like working with the youth and working at the grassroots, basically trying to change the social stigma to where smoking is seen as undesirable. We think that's going to give us our ultimate success.
That shift in attitude is beginning to have tangible results. Meet Daisy Lambert.
I used to try to lie to myself and say, yeah, 10 cigarettes, you know, that's only half a pack, but it was a pack a day.
A longtime smoker, it took a real jolt to make Daisy and her husband think about quitting.
My youngest son, he's 12 now. At the time he was about 10, but he just came home one day and looked at me, Mom, you should quit smoking. And, you know, I thought, well, yeah, another one of those. Okay, yeah, I will, you know. No, and then he stopped me in my tracks and says, no, Mom, I don't want you to die. Looked me straight in the eye and just, you know, then it hit me like a ton of bricks, you know, my little boy worrying about things like that, you know, that time it just hit home.
But Daisy knew she couldn't do it alone. With help from Maniilaq Association, she and her husband made a plan to attack their addiction.
A co-worker, Kim Rotman, and she said her daughter was talking to her about her smoking, you know, and so there's my co-worker and then my significant other at home. So I said, let's quit. Let's set a date. Let's try it. You know, we can try. And so we set a date and we stuck to it. June 23rd. It was a Monday, and we gave ourselves about, I guess, 3 weeks to, you know, mentally think about it. And Walt had mentioned, you know, if you're going to do it, you know, write down when you go smoke, why you go smoke, and, you know, just keep track and look at it and just keep track. Why do you smoke? When do you smoke? And so we did that. And so for 3 weeks before our date, and then the day came, and usually we're in the smoke room, 8 o'clock, smoking a cigarette, getting our daily plan lined out for work, and, you know, we're back in there in another hour, and, you know, so we're, anybody wanted to find us at work, we'd be in a smoke room.
One region that is seeing results from their programs is the Aleutian Islands. In these beautiful islands where the tundra meets the sea, every travel plan is weather dependent, and for a good reason. Sudden storms, persistent wind, and thick fog are all par for the course here. And unlike most of the regions of rural Alaska, there is no central hub here. So even village-to-village travel means flying to Anchorage and then back again. Ingrid Cumberledge works with the Eastern Aleutian tribes.
Our tobacco program at Eastern Aleutian Tribes is really, in the last year, focused on getting our village-based counselors, our local lay people that we take locally and train, to kind of be the experts to do the program. So we've been sending them, whenever there's a training or a meeting, we try to send our village-based counselors out to do it because they're in each of our villages. We do a lot of family-based after-school programming. We bring people together as much as possible in a smoke-free environment and really encourage those sorts of things. The focus that they're working on for this next year is focusing on helping people develop clean air policies within their home. So that's a big push right now. And again, the village-based counselors will take the lead on that because they're primarily responsible for all the programming.
One of those village-based counselors is Brenda Wilson of King Cove.
And to see young people smoking a cigar and inhaling it with great big puffs of smoke really makes you wonder where the concept for cigars came from.
All the schools in the region already have clean air ordinances, and now Brenda is starting to see the tide of peer pressure reversing.
I think it's the strongest tools. I've seen it in my daughter's 16 years old, and I've seen it in her age group of kids that go and they police each other. They know what everybody's doing when everybody's doing something, And if a student in their class starts smoking, they start on each other right away. And we've seen quite a few of them quit smoking. And there was one that just quit just about a month and a half ago. And I think it's because of them pressuring each other. And usually it's the opposite of pressuring each other to, come on, let's try it, you be cool. And it's the opposite with them in their sports is, come on, you can't do what I can do if you keep smoking. And so they quit.
One person helping to reverse that tide is Brenda's daughter, Roseanne.
Well, one of my friends just started smoking, and I just thought that idea was terrible. Whenever people do it, I just try to get them not to, because it's not very good for them. It causes all kinds of different problems for all of their kids. I have asthma myself, and I've never tried it. And all my cousins, they don't smoke, and I just try hard not to have my friends smoke either.
Like many of the schools in the state, King Cove motivates its students by making all sports tobacco-free. 3 King Cove boys explain the tobacco and drug-free contract they have to sign to play in sports.
There's no legal usage on trips. You can't have cigarettes, chew, anything to do with tobacco, alcohol. And I'm pretty strict about that
and
stuff.
If someone catches you, a faculty member of school, you get kicked off the team, and any after-school activity for
60 days.
Yes, a minimum of 60 days, or the length of the season, whichever is longer.
It's a lot of what we do too, media, posters and brochures. We get the word out to the region.
In Bethel, there is also a focus on kids.
Our program was opened as a pilot program in 2000. We started off with a few patients from one of the clinics. We've seen like about 2,000 patients now. And we have over 700 patients in our program to date.
There are approximately 12,000 children in Alaska today that will become addicted and killed by tobacco unless we do something about it. Meet Mary Beth. She was addicted to chew and cigarettes, but with help and support, she and her friend Alexandra kicked the habit.
I first started chewing when I was, I think, 12 years old. And I think it was caused from peer pressure. And, well, I tried it once and I got addicted. And it was pretty bad. And I tried quitting tobacco since, I don't know. But it's really hard to try to quit tobacco. I heard of the program before, so I decided to go over there and ask for help. I felt free and healthy. It was really good. My body felt stronger, and I felt stronger mentally because I quit, and I thought before that I wouldn't be able to quit, and I did. That's what I was happy about.
It's impossible to tell exactly how much pain, suffering, and healthcare costs will be saved because Maribeth will now walk through her lifetime tobacco-free. But it is clear that the counseling, the nicotine gum, and patches were a wise investment. Today, no matter where you are in this vast and beautiful state, no matter how remote your location is, help with tobacco is as close as the telephone.
And how can I help you today? What health problems are you having?
The Alaska Tobacco Quit Line began in January of 2002. Thousands of Alaskans have received help with their quit attempts since.
Alaskans who smoke or chew tobacco and want to quit are provided a free cessation counseling through the Alaska Tobacco Quit Line. And this is a statewide 24-hour day, 7-day-a-week program that is staffed by nurses who are trained in cessation.
Every day, there are ordinary people all across this state that are doing extraordinary things. They and thousands like them no longer accept tobacco as a social norm. They are helping to make Alaska the healthy, strong place it could be.
We're the people of the earth. We're the people in the dream. We're the people on the highway. The people on the street.
Thank you, State of Alaska, for sponsoring this program, bringing this program to the viewers of Heartbeat Alaska in many states and now several different countries. And thank you so much for joining me. Thank you for your avid, loyal viewership. God bless every single one of you. Join me again next week when we travel to remote villages in rural Alaska.